Good morning, everybody. We're just waiting for some people still coming in through the waiting room. Welcome. Welcome back. If you were here yesterday, welcome to day 2 of the Charles Sturt University Libraries Research Group Australasian Public Libraries Conference #1. This is the inaugural instance of this conference, and we had a great day yesterday. We had lots of good speakers and presentations and lots of people turning up to listen and learn from each other. So it was a terrific morning. If you would like to jump into the chat and say where you're coming from, that would be terrific. If not, that's okay. Just sit back and listen. So thank you very much for attending this session this morning. I'd like to acknowledge that I'm speaking to you from the lands of the Wurundjeri people of the Kulin Nation in Naarm or Melbourne, and recognise them as the traditional owners of the place where I have the privilege of living and working. So this is the third session of our conference following 2 sessions yesterday. Each of those focused on the role and functions of public libraries and also on various aspects of public library collections and their collection development and management. In this session this morning, we will be focusing on some of the programs and services offered by public libraries and on community engagement in general. We have 3 excellent speakers that will take us through to 11:30 New South Wales time. So our first speaker is Dr. Jo Kaeding. She is the Program Director and Course Coordinator in the Postgraduate Library and Information Management degrees at the University of South Australia. That's how it is today. Maybe tomorrow it'll be something different. Jo was just telling us about the challenges of combining universities in Adelaide. Sounds like not much fun at all. She also earned her PhD from the University of South Australia. Her research focus is in conclusive and accessible library services for people with disability. She will be presenting on that topic today with her presentation titled Enhancing Access in Public Libraries for People with Print Disability, an Australian Focus. So I'll now hand over to Jo, who will start sharing her screen and present. If you have any questions, please put them in the chat and we'll be keeping an eye on that and making sure that we get Jo to talk to you about those things. So I'll hand over to Jo. Thank you, Jo.
Thank you, Jane. And I'm just double check, thumbs up, all good. You can see my screen fine.
Beautiful.
Great. All right, so thank you for the opportunity to present today. And I am presenting from the lands of Ghana and Paramank people, and it's a little bit chilly here today. But so today I'm going to actually talk about the results of a research project into print disability and public libraries in Australia. I undertook this research with Dr. Agata Merva Montoya from Sydney University. Our research has been undertaken in 2 stages. The first stage was an online questionnaire undertaken by public librarians in Australia, and the second stage was a series of in-depth interviews with librarians. There is a third stage which will be coming, so keep your eyes peeled for that one. Okay, so really brief overview. Stage 1, we sent out invitations to public libraries throughout Australia to answer the online questionnaire. We received 297 valid responses, and that actually equates to approximately 4% of the total full-time effective staff in public libraries in Australia. So it was a good portion of responses that we got. The summary findings from that questionnaire were essentially that there's inconsistent funding and policy approaches to print disability across different library networks, limited awareness and training among library staff on how to help patrons with print disabilities, low confidence among library staff in the accessibility of their library websites, and probably even more importantly, their library catalogues, because I think we don't think about that a lot. Low confidence in accessibility of ebooks and e-audiobooks that their libraries offered, and limited awareness of existing services within the print disability communities in their library areas. So to gain a deeper understanding of these results, we undertook some in-depth interviews with 26 self-selected library participants from stage 1. So at the end of stage 1 questionnaire, participants were asked if they were willing to be interviewed by the researchers. Close to 70 participants responded yes, which is fantastic. And that resulted in the 26 interviews available for research in the time frame that we had to do that. Interestingly, that number is made up of 15 rural and regional libraries and 10 metropolitan libraries. That's actually given us a really fantastic insight into accessibility in rural and regional libraries. So quite often the focus is, you find out what's happening in the metro areas. So it was really great to see some differences there, which I'll talk about. We are currently still analysing an extensive amount of data, but today what I'm going to give you is some of those preliminary results. So our first question was, how do public libraries approach the provision of accessible resources and services for people with print disability? So we found that very few libraries do have a disability access and inclusion plan, which is actually library specific. So a lot of public libraries have a broader council DAPE, and that covers, all of council, but it's not very specific. So obviously that means that it doesn't get into that sort of specific information about print disability and whatever. It's far more generic. When we looked at staffing, we found that, and this is really quite interesting, that and we know it, but in metropolitan libraries, there was generally a professional library role where somebody had some level of responsibility for disability access and inclusion. So that might have been quite often the outreach librarian's role. But in rural and regional libraries, where sometimes you might have only had one staff member or, very limited, there was basically often nobody who had that in their role remit. There was nobody who had responsibility for that. It was also stated by some respondents that the level of knowledge and experience in rural and regional areas had actually been impacted, and this is, by probably for a specific state, but it may be Australian-wide, had actually been impacted by a statewide reduction in employing level 5 library professional roles. So what that meant is that in those smaller rural and regional libraries, there was often nobody who was at that more professional level. Whereas clearly in a metropolitan library with a larger workforce, there will be a couple of, at least one or two or more people with those professional qualifications working there. Okay, in terms of budget, obviously we're all very, conscious of getting value for money. So that was sort of a common theme, but it was more of a focus in rural and regional libraries. One of the common strategies that the librarians used was focusing on purchases which were considered to be inclusive for all. So the concept of universal design was really mentioned many times. So it was very much along the lines of, we've got this much money, what can we purchase to get our biggest bang for our buck, essentially, to, you know, meet as many people's needs as possible. There was another really interesting issue which was raised, which was the concern about cost shifting and concerns about what other services such as NDIS should actually be addressing some of these resourcing issues. So that was just something that came up. Okay, around services and equipment. So, sorry, despite the concern around budgets, it really was good to see that a lot of the libraries did respond positively to providing services and equipment. So there was a really great range of programs, and we know that public libraries are just outstanding in programs. So there was a great range that was specifically for people with print disability. So, for example, the Next Chapter Book Club was a really good example, which, for those of you who don't know, is a book club for people with a range of disabilities, and they really did help cater for people with print disabilities. And then also the use of social workers coming into libraries as well was a really positive response there. Interestingly, librarians were really aware that as their communities age, there's increasing numbers of people with print disability. And some libraries were having dedicated library tech specialists who would work with aged and disability communities to sort of compensate for that. For example, one librarian stated that we support technology access for people with print disability through our home library service, as well as anybody who comes into the library. We will specifically help people who are aged with their needs. There was a great range of equipment that was available, not everywhere, but some really good examples, such as Envoy Connects, which is a really simple audio player, which has a tactile keyboard, reader pens, Victor Reader Stratus players, which are also really easy to use audiobook player, magnifiers, and different range of e-reader devices. Within the library, people had oversized keyboards, screen readers, and scanners to enlarge documents as well. In terms of collection development, there were a couple of interesting things that came out. One was, and I'm sure that people are really quite aware of this as well, is the impact of centralisation of selection. So, and this was really rather keenly felt in rural and regional libraries, where selection occurred far more centralised, and they literally got what turned up in their boxes and crates. So that, had an impact on, I guess, being able to cater to the needs of their community from that point of view. But it also meant they felt quite removed from knowing what the accessibility of the resources that came to their library, because they didn't specifically select them. So for one quote, which really to me stood out, was, we have to take what we're given, pretty much. To be honest, we don't look for much in regards to accessibility. We just take what we're given. But a lot of them did want to be able to assess accessibility of resources, and they talked about things like perhaps we could have a checklist, really just being skilled in being able to do that. Some of them spoke about their dementia-friendly collections and how they, also were supporting people with print disabilities through larger font, shorter stories, less complex narratives. And then there were comments around the fact that by being in centralised networks, they did have access to a much greater range of resources as well. So there was a positive factor there. All right. We also asked what were the key barriers for librarians. So, some of the ones that you probably would anticipate: limited staff time, funding, and knowledge. And this was really more keenly felt in, again, the rural and regional areas where there was not one person who had, nobody had looking after people with disabilities or providing accessibility in their job description. This was really, really, there were a couple of really interesting things here, which we're probably all aware of as well, but there were concerns about the lack of titles for younger readers. So in terms of large print. And, this is a big issue. It's very difficult to get large print for younger readers. Go into a children's area, you're going to really struggle. A need for more titles by Australian authors for large print. And then obviously the expense of large print, we all know it's a lot more expensive. And then the concern that there is still somewhat of a delay in the publication of latest releases. Another barrier was a lack of community awareness. So there were concerns here that the librarians felt their community with print disability didn't know what the library could offer. This was coupled by a concern that the library staff felt they actually weren't promoting their resources and services to this community. And as a whole, the library felt they didn't, or the librarians we spoke to felt they really didn't understand the needs of the people with print disability in their community. So there was that sort of lack of connection there. Okay, technology. There were a number of areas where this was considered to be a barrier. Number one, which again, I think we're sort of all aware of, is limited digital literacy skills. So if what we're offering for people with print disability is only in a digital format, then we're actually creating expectations that people with print disability can actually use digital technology and access like that. And basically, that was a big concern because a lot of the people who were wanting to access that struggled to use resources online. Coupled with, in particularly rural and regional areas, lack of access to the internet. And then, similarly, which was really good to see, that real awareness that digital does not mean accessible. Just because it's in a digital format does not mean somebody with print disability can access it. It was also really good to hear a couple of people note that they were concerned about their library catalogues being a barrier. So, for example, someone noted the font is small and cannot be enlarged. You can't enlarge font on a library catalogue. You have to be able to use the keyboard and the mouse to navigate the user interface, to know how to place a reservation, to know how to spell the author. I mean, how many times do we have patrons just walk away because they think there's nothing in the catalogue when in fact it's just that the catalogues are not very friendly if you get it wrong. And we're all used to search engines. And there's no option for the text to be read aloud. Okay. Oh my gosh, I'm doing so good, I think, with my timing. So the next stage in our research is to talk with the print disability community and what is their experience with public libraries. So just a little shout out, if you do know anybody in that position who might be interested, if you could point them my way, that would be fantastic, because obviously the more information we're able to get, we can then start marrying the public library's experience with the print disabilities experience and hopefully come up with something really, really useful. Okay. All right. How How quick was that, Jane?
That was outstanding. That was 20 minutes. Well done. So
Okay,
we've got a couple of comments here that actually
I'll
could be
stop
would be.
sharing.
Jody has mentioned that some council DIAPs might have
Yeah.
provisions for libraries. Did you find that? Any of the council
Um,
ones recognise the library was actually part of the council?
um, some and some not. It really depended on the council. And I do understand that from a council's perspective, if they're going to have a whole date for the whole of council, they've got to include, rubbish collection and dogs and everything. But to me, that speaks to why libraries should then have an individual DAPE, which feeds into the corporate one, much like you have a corporate strategic plan. But then you will have, a library strategic plan that will then feed into the broader one.
Mm, yeah. And Nerida's made a point that you mentioned there's an increase in people with print disability, but could it be that we're just more aware of them rather than there's an increased number?
I think it's probably both, but I think it's the aging population that is really starting to tip those scales. And similarly, um, dementia, people with, who experience dementia start to experience some real print disability issues. And I went to a wonderful talk with Dementia Australia and chatted to some wonderful people there. And, they was talking about how they still love to read. And, one particular lady I was chatting with said, I lose track of the story, but I love to hear the language. So I just listen
Mm,
to the language. Um, so there's some really great things potentially happening in that space. And that's where I think if publishers can get on board a little bit more in providing resources which support people with dementia, we're then automatically opening it to a big range of people with different print disabilities and and dyslexia and autism. A lot of those works are that universal design where they do sort of support a whole range of people.
mm.
I'm trying to
Um,
remember the publisher there is one publisher who someone else might know who does publish dementia friendly novels. It could be a New Zealand one. I'm pretty
okay.
sure.
If
Yeah.
anybody knows, pop it in the chat. Val has a question for you. What are some of the most economical solutions or devices that financially challenged libraries can look to initially? Have you come across
Um,
anyone engaging
yeah,
with that?
I would be looking at those envoys because they're that really easy to use audio players. They have like a stop button, a start button. Oh, thank you for providing. Yeah, Dovetail Press, beautiful. Thank you. Um, so yes, so those are fantastic, and I know that Vision Australia are really keen to be able to support public libraries in providing audiobook access through those envoys as well. So I would, in the first instance, even reach out to not autism, to Vision Australia, and see what your local Vision Australia can support you with in that, because they are happy to do a bit of training with staff in using some of those technologies. And then you can take that out to your communities as well.
Yeah, great. I was interested in your comment about cost shifting and NDIS.
Mm.
Have you come across any instances where public libraries have actually received funding from NDIS to
No,
provide?
and they're not going to.
Right, okay.
Yeah. And so this is where I would actually kind of push back on that, because I think I think it's very easy to say, well, NDIS, this is an NDIS issue. Somebody, the person should claim, these sorts of resources from NDIS, but NDIS don't actually supply resources like that.
Mm.
Plus, we also have a responsibility to support everybody in our community. And so that resource would actually then potentially help a whole range of people. Sorry, Jane, I cut you off.
No, I was just going to say to people who aren't from Australia, the NDIS is the National Disability Insurance Scheme, and that is a fund that comes from the government to support individual needs for people with disabilities. But it's been fraught with all sorts of challenges, and obviously supporting libraries that also support that community isn't part of their remit, perhaps.
Yeah.
And we've got we've got another book, another publisher, Open-Ended Books from the UK. They're another one that do the dementia friendly.
Okay. I didn't know about that one. Well, that's good to know.
Good. So are there any other questions? Anything anyone else would like to add, or you can pop into the chat? Anything your library's doing that is working with this group would be really good to see.
And I guess it would be great to know if it sort of resonated with people in their experience in their own libraries as well. Those findings, if any of that sort of resonated, it'd be good to get that extra confirmation.
All right. Well, thank you very much, Jo. It's been lovely to hear from you. Fantastic to be able to have you along this morning. I hope you get to stick around as well.
You're welcome. Thank you. And thanks for inviting me.
Pleasure. All right. So we're going to move on to our second speaker. This is the lovely Nerida from the Campaspe Library. For those of you who are not familiar with Campaspe Shire, it's located in northern Victoria and includes towns that you might have heard of like Kyabram, Echuca, and it borders the southern banks of the Murray River. Nerida has worked in the library industry for over 30 years and has been working in community outreach with Campaspe Library since January 2015, engaging those in need at locations such as care facilities, hospitals, community groups, and individual homes. Nerida is going to talk to us about her work now in her presentation titled Social Prescribing Library. Over to you, Nerida. We'll get you to share your screen.
Thank you. Are we good? Can we see it?
Perfect. Go for it.
Beautiful. Thanks, everybody. So at Campaspe Library Service, we take and make every opportunity to engage with our communities, and we believe that one positive experience with one entity may leave a lasting impression on the entire organisation. So we feel it's not about the learning, but it's about the interaction, the experience, and the social connection. Oh, my PowerPoint's not moving. What's happening? Uh-oh. Okay, Jane, my magic hasn't worked.
Is there a little button, maybe like an arrow key? Hit the right arrow key on your keyboard and see if magic occurs.
Here we go. Hang on. Let's see if that works. Oh,
Got
sorry,
it.
guys.
Well done.
So sorry about that. Yeah, so we believe that public libraries play a central role as a social place for their communities, as most of our libraries, big or small, have a space for learning or creating or experience or sharing. But I guess our question has been, what happens to the community members that cannot come to us, whether they're physically unable or psychosocially or cognitively challenged or isolated by choice or location, given our, we're very rural, or their situation. So what are their options? So we've taken a very strong, my PowerPoint's going to be the end of me, isn't it? We've taken a very strong position to partner with local health service providers, as well as care facilities, carers, families, and our intention has been to raise the awareness within our communities of the capabilities of our libraries outside of the actual physical walls of the building. So we're reaching out and supporting community members who are isolated, whether it's location, circumstance, or choice. And we always look for ways to develop our connections with community agencies and for ways to better serve our communities around wellbeing, health and social support. And so our collaboration with our service providers has actually connected us with people who wouldn't have considered the library as an applicable resource. And in strengthening these collaborations, it's supported our libraries in becoming more effective public spaces. So through our partnerships with our local providers, they now view libraries a little differently and more in relation to where we fit within the health service social determinants of health, which in a library we go, what's that? But in a health service, that's what they live by. Not live by, but that's what they're guided by. So there's also been a strong recognition that people who live in our residential aged care are often at risk of isolation and disconnection from their communities too. So what is social prescribing? Social prescribing looks to find ways to encourage and enable individuals to take up opportunities to socialise and to get involved in things that interest them. Sounds easy, doesn't it? It offers opportunities for healthcare providers to connect with community agencies, develop sources of support for people who need assistance with their mental health, who feel lonely or isolated, or have social needs which actually impact their well-being. And we believe public libraries have the potential to sit at the heart of social prescribing through our connections to community, our social engagement opportunities, our cultural, learning and creative experiences, and our signposting to non-medical interventions. Through informal arrangements with our local health providers, we have been providing social and recreational support to the residents of Campaspe in Victoria and Murray in New South Wales for 8 years. And we've further developed our relationship to grow and improve the service and address methods and outcomes that are beneficial to the health service, the library service, and of course the recipients. So our referrals are received from our local health service partners, but not from the GPs, which is a standard social prescription method. Our referrals come from allied health, so complex care, social workers, advanced care, hospital to home, transitional care, and community health workers. But families and community members are also able to refer their family members, their friends, or their neighbours. And care facilities are eligible for our wellbeing programs and can refer individual residents for our home visiting program. There is a criteria that those referrals need to meet to be eligible for our programs, but everyone is contacted and spoken with because at times we can refer those people on to other service providers or supports if we are unable to help. So as the community outreach coordinator, I follow up the referrals and make first contact. And this is through an informal interaction in the individual's home or their place of residence. And its intention is to promote and maintain the health of the individual, to support their family or carer, to promote support systems that are available. And our ultimate aim is to re-engage that individual into their community. But we recognise that this isn't always possible or achievable, so we have other in-home support options which are available. In March 2022, we were awarded the State Library of Victoria Barrett Reed Scholarship to undertake a research project around public libraries and social prescribing. This scholarship enabled us to evaluate and review our informal social prescribing arrangements and apply learnings to improve and broaden our own program, and then share these learnings with libraries and other organisations who are interested in undertaking a role in community social prescribing. In doing this, we've circulated a final report of research, best case examples and recommendations, and we included a toolkit which was developed for library and community services who are interested in taking up a more formal role in the social prescribing space. And we've also produced and shared 2 podcasts which support involvement in community social prescribing. But the success of that project has far exceeded all of its original objectives. So I have my little brag moment, forgive me. I'm an international member of the National Association of Link Workers in the UK, one of only 2 international members. Campaspe recognised nationally and internationally as a leader in community-led social prescribing. The Social Prescribing Library Report was a resource at Australia's National Social Prescribing Roundtable in 2024. We participated in ABC Radio National's Life Matters session on social prescribing and presented at the Australian Library and Information Association's National Conference last year. We were invited to participate in a fireside chat with Professor Carolyn Wallace, who is the Director of Wales School for Social Prescribing. And we were one of the features showcase, I guess, examples at the World Social Prescribing Day, Victoria's 2025 forum. And just more recently, we've been invited to participate in an upcoming workforce study of experts by experience, a research project that's being conducted in the UK later this year. We're feeling a little chuffed, I think you can tell. I'm going to skip this one. I'm sorry, because I was talking too much. Why should libraries be involved? Well, we already are. There are many of these services already occurring. Staff in libraries already regularly provide information to direct people to community groups and services. They use directories and their local knowledge. And libraries offer a myriad of programs and services, as Jo also said, which provide opportunities to socialise, learn, engage, create, and so much more. And for people who are confident and skilled, to find their own way to the community group or activity, this provision of information and direction works well. But social prescribing supports the people who lack the confidence or the knowledge to approach other agencies or get involved in community groups on their own. And the personalised support gives people the time and confidence to work on those underlying issues that affect their well-being. So our toolkit has been developed to support organisations to enter the social prescribing space on 3 levels, which I like to refer as toe in the water, wade in, or deep dive experience. So opportunity 1 is for signposting or information referral. Libraries are considered professional when it comes to locating, assessing, validating, and connecting people with information. So the opportunity exists here for public libraries to expand this to the provision of information about local services, groups, activities and actions that support people in knowing what choices are available for them to socialise. And it also has the potential to identify gaps and trends and to influence our program development and partnership opportunities. Opportunity 2 is around activities and programs. Libraries have the capability to bring together community and health service providers to co-produce and support each other in developing and delivering activities and programs with social inclusion, health and wellbeing opportunities at the forefront. And opportunity 3 is assertive outreach, where we are well positioned to be assertive in our outreach by encouraging, supporting and enabling people to take up opportunities to socialise, by providing opportunities for healthcare providers to connect with community agencies and develop alternate responses and sources of support for people who have social needs which affect their well-being, and by building capacity in people to engage in self-care, which enables them to identify their needs, goals, and achievable solutions. And finally, by partnering with other community service groups to maximise our resources, reduce duplication of efforts, and increase productivity. These slides compare our social prescribing characteristics from 2023 to 2025. Basically, our referral sources remain the same, with allied health key in this aspect. Our male to female ratio didn't change by 1%. And the age of our clientele is very reflective of our region's demographics. In regards to our service periods, we've improved on meeting needs within the 3-month period and reduced the 6-month period, but we remain constant for the longer periods of support. And our prescriptions are virtually the same, with the exception of an increase in equipment loans and a decrease in books on wheels, which I see as reflective of a community that is moving towards technology and supportive equipment. Interestingly, despite our ability to address needs in that shorter period, our average visits per client has increased slightly. And the number of client sessions per month has increased considerably. But again, I feel this is reflective of our improved capabilities in meeting needs. And our delivery of wellbeing sessions remains the same, with a small increase in the number of attendees, and our volunteer numbers are slowly growing, which therefore reflects the increase in volunteer hours. We rely heavily on our volunteers to support provision of our services, but volunteering unfortunately has not returned to its pre-COVID popularity. And it's not just libraries, it's across the board. Organisations utilising volunteers have seen a significant decrease in volunteer numbers. And my understanding of that is that it's due to the changing social and demographic shifts due to the pandemic and the increased cost of living pressures. So these factors have led to a reduction in volunteer numbers or people volunteering, and also a decrease in the hours that they do dedicate if they are volunteering. So my favourite part, because I can't help myself, I'm a librarian, I have to share a story. Oh, I better press some buttons. Keep reminding me, I get carried away. So we met Graham after he underwent a quintuple heart bypass. His wife had passed years prior, and they didn't have any children. But he didn't really understand why they'd done the procedure, because he actually couldn't see a point. So we visited to begin with and just chatted and inquired about his life and his experiences. And though he was despondent to begin with, he actually began to look forward to the visits. So we supported him as he started to resume some activities. We went for a walk around the park and encouraged that. Tea and a scone, who can resist, at the local bakery. He started to visit the library, and I have to tell you, he actually isn't a reader, he's illiterate, which we didn't know for quite some time. But he came for the company and the outing. And we did a very strong advocacy around saving a gum tree near his house that was to be removed, and he was going to chain himself to the tree. So we did that more politically and saved the tree with him. It wasn't long before he ended up back on the golf course, and he would pick up, as he would say, his two old friends and take them for 9 holes of social golf. But his friends were 82 and 85, and Graham was 89. And I was famous, I'm still famous for saying, "You're never too old, you're never too old." And I popped in one day, and Graham was like this excitable young boy, and he couldn't wait for me to come in. And I was like, "So what's going on? What's happening?" And he took me to his garage and with pride showed me the brand new bike he had purchased. It folded up to fit into his car boot. It had a battery powered in case he ran out of energy, and it was the brightest yellow you've ever seen in your life. So I enthused, "Graham, that's wonderful." And then I said, "So just, how long since you've actually ridden a bike?" And he said, well, actually, he couldn't quite recall that, but it had been quite a long time. Now, in my head, I was going, "Oh my God, Nerida, what have you done? You're never too old." Oh, couldn't believe it. However, I can proudly say to you today that Graham loved his bike, rode it many, many times, covered many miles, experienced lots of bike paths and trails without incident. At 94, he experienced his first flat tyre and decided it was time to retire from bike riding. So the lessons here, or the learning here, is when you're encouraging someone to take up an activity that interests them, or learn a hobby, or take up a part-time, or get back on the bike, pardon the pun, don't underestimate anyone or anything that they set their heart on. If I've got time, Jane, I'd also like to introduce you to Jim.
Yes,
so when I was
plenty of time.
asked to meet Jim, he had lost confidence in being with people and having conversations, and had withdrawn from his family and friends as he'd had a diagnosis of Huntington's disease. When I first went to meet him, Jim very gruffly said, "What is it you want?" And I said, "Oh, just to sit here and chat." And Jim was like, "Why?" I said, "Well, it's actually my job. It's my role. It's a great job. I get to meet people. I hear their stories. I share experiences with them." And he was absolutely like, "That's your job?" Anyway, following my third visit, as I was leaving, Jim's wife came out to see me off, and she was quite emotional and said, I haven't seen Jim so animated speaking with someone in such a long time. He so looks forward to your visits. So with our support, Jim went on to attend a planned activity group 2 times a week. He became involved in a men's group and regularly went on day trips with them. As Jim's condition deteriorated, we supported him and his wife as he transitioned to a care facility. We continued to visit him and bring him things of interest which we shared, puzzles that challenged him and us. And as his ability to speak decreased, we chatted away and learnt to communicate through his facial expressions. We were in Jim's life until the disease eventually took him. Earlier this year, I attended an information session and just by chance ran into Jim's wife. And she introduced me to the people she was with as the wonderful person who came into their lives when the challenges seemed insurmountable and who genuinely and honestly made a difference to their quality of life just by being there. So I am a little bit biased, but social prescribing's not that difficult. It's just about being there. So these stories are great examples of those times I spoke of at the beginning where I said one positive experience leaves a lasting impression. And it's these stories, these case studies that have helped us to engage the community, to build our partnerships with the health service providers, to gain continued support from our stakeholders, and to grow and develop our outreach programs and our social prescribing service. And all that we have been doing and continue to do supports social, mental, and emotional well-being. And importantly, our local health providers recognise that the social role of libraries is as information disseminators and connectors to community and recreational support. So we work together very well. The potential for social prescription is on the rise in Australia. It's still very new, but it's growing and rapidly. And we strongly believe that libraries have a real potential here. We're already involved in the basics of social prescribing, and the research project conducted highlights that libraries are well positioned to undertake a more active role in social prescribing. But what we need now is intentional awareness of the capacity of public libraries in community building and engagement, and the potential for health, community services and volunteer sectors to successfully work collaboratively to provide non-medical interventions. And the reality that our medical model in Australia alone cannot address healthcare's current challenges. And the role of public libraries when making decisions to improve community health needs to be raised, and it is growing. So thank you for having me today. I'm more than happy to answer questions either today or if they arise later. There's our links to our report and our podcast. And thanks, Jane, for inviting me and everybody for tuning in.
Thank you, Nerida. I love hearing you present. I heard you first at ALIA in whenever it was. And it's fantastic to hear what you're doing and to have the chance to share your work more broadly here as well.
Thank you.
There's some good comments in the chat there. Everyone's amazed at what you do and are thanking you for the work that you're doing. There's been requests there for the report. There's some links in the chat and also the QR codes are on the screen at the moment. So we'll leave them there for a minute. Also to the podcast has been a request, but that's also there. So that's great. Ellen,
if you can't access them, just drop me an email and I'll send you the links to either. Anyone wants to email me directly if they have any problems, I can send them out.
Fantastic. Thank you, Nerida. Ellen says, it sounds like a great program, Nerida. Wonderful for your community. Thank you for all the information, including the statistics, which were really good to see. I like that you are seeking to find the people who might otherwise slip through the cracks. How is succession planning happening? I assume you'll be around for a while, but are other staff involved too, so you can have a holiday?
Yeah, so I do have a backup staff. So I have a wonderful team of volunteers, huge team of volunteers, and they so enjoy what they do. They're very empowered and I just oversee. But there is obviously that first need to action the referrals. So I do have a backup person for when I'm away. Generally, it's only if I'm taking leave or yes, if I'm off sick. The only difference there is that her preference is not to go out to individual homes. There is some training requirements to be able to go into a person's private residence. So when I'm away, those follow-ups are done by phone rather than in person. It is a little bit trickier, but you know, we survived COVID by phone contact, and the program continued to run. So it's just not quite as personal if you can go and actually meet them in their home or at their choice of place, face to face. So, and I always say to the girls, if I get run over by a bus, such and such, such and such, and they just say, don't get run over by a bus.
There's your answer. So it seems to me that a lot of libraries are doing a lot of this sort of thing anyway. The thing that you're looking at here, and obviously the UK example is a great guide for this, is the connection with allied health providers as a conduit into your programs.
Yeah.
Are you aware of any other libraries in Australia that are interacting with allied health providers to get clientele for this sort of work?
So certainly on that first and second level, there are other libraries that I guess are in connection with their health service providers in letting them know the programs they're running and what's available or what are they looking for their clients. But to my knowledge, we're the only service that actually take direct referrals and do in-home client visits at this stage. But we only advocated, we did the research project in 22-23, released the report late 23. And like I said, social prescribing is still very new in Australia. And in the UK, it's strictly health service led. We're advocating for community led social prescribing because our health services, they're overburdened as it is without adding this onto their plate.
Although this would also relieve them of some of the work.
Yeah, that's exactly right. So by partnering with us, the intention is many people go to their health service because it's somewhere where they feel safe. It's somewhere where they feel welcoming. It's not necessarily about requiring a script or a medical appointment. And it's one of the few medical appointments are often the few outings that people who are isolated still undertake or, get. So we're trying to reduce that feeling of need to go there and to get back into their community in a supported capacity, which, like you said, then it has a positive impact for the health service.
That's right.
And we're not looking to do it without the health services. We want to partner with them. We're just saying we'll take the lead and you work with us. And it's working well here, really well. We've got all of our health services on board.
So. Excellent. So if there's a library that's interested in doing this sort of work, what would you suggest be their first step towards making this happen?
There's lots and lots of examples of where a pilot or a project has been run. I guess the thing that I think is sad about that is they have a set period. They get to the end of their 6 months or their 9 months or their 12 months or their funded bucket and they cease. So yes, I understand that we all need to fund these things, but we embedded it within our programming and then sought funding after we could say, these are the impacts we're starting to have even in a very small capacity. If we can build on this and if you invest in it, then it will grow, which it's done. So we've sort of done it in reverse because we find that and we see too often, there are lots of examples where people will do that project, but it only goes for the 6 months and then there's no funding for it to go on, so it doesn't go on. And then your community becomes disappointed because they're like, what happened to that? What happened to that person who used to visit me or who taught me to knit or, who gave me some confidence to be out and about? Oh, sorry, they can't come anymore. So sort of try to look at it in reverse. Can you embed it in an existing outreach service or even in that opportunity 1 stage, opportunity 2 stage. And when you get some ground going, if that's what you want, aim for that opportunity 3.
Excellent advice. Thank you very much, Nerida.
Thank you.
I don't think there's any more questions or comments in the chat. So I think what we'll do is we'll move on. So thank you so much, Nerida. It's been fantastic to hear from you and really appreciate you being able to drop by and give your presentation today.
Thanks for having me.
All right, so our final speaker for this session is Ian Phillips. Ian is a director of I&J Management Services, which is a small consulting firm working with public libraries across Australia for 25 years on strategic planning, service reviews, community consultation, and statistical analysis. Ian compiled the National Standards and Guidelines for Australian Public Libraries in 2016 and 2020. He also managed and analysed the 2022 Victorian Public Library Census and Survey Project for the State Library of Victoria and Public Libraries Victoria. Today, Ian is sharing his presentation titled Understanding Library Non-Users. They're not all the same. I'll hand over to you, Ian, and I'm going to find whoever's making that interruption and mute them. So hopefully that won't continue again.
Okay.
Looking good. You're on slide 3 there, though, Ian. There you go.
We're back to the start. And you can hear me and see it, everything by the sound of it.
Perfect.
All right. Can I just start by saying thank you to Charles Sturt for putting on the conference, to Jane for hosting today, and Joe and Nerida for the insights that they've already provided us with this morning. And I can say from first-hand experience, having worked with Campaspe Libraries, Nerida and the whole team up there do a wonderful job in understanding the needs of the people who live in their local community and their local demographics. Social prescribing stuff is certainly something that the sector needs to look at. And also, thank you to everyone for coming in and listening to us this morning. As Jane said, I work for I&J Management Services on the I. The J is my partner in crime business. We're a small consultancy and work with libraries across Australia on a range of different things. Today, in a session that's around community engagement, I wanted to talk to you about the people who are not currently engaged with the library, and that is the non-users, the people who are not presently users of public libraries. What I'm about to talk to you about builds on some work that we've done over many years with libraries. It's been documented in my Anna Libraries blog, and the link's there, and it will come up at the end of the presentation. There was an article published in Public Library Quarterly earlier this year, and it also draws on research and surveys that we've run with the State Library of Victoria and Public Libraries Victoria and many different libraries across the country in understanding their library users and library non-users. To start with, we know that everybody loves libraries, and you can't not love libraries. They give you access to resources, they're open to everyone, they're nice places, they're staffed by welcoming people. Everybody loves libraries. Even people who don't use libraries, many of them love libraries. And then there are a small group who are probably not so thrilled for various reasons. But our starting point is there are lots of library users and lots of love and support for public libraries. But whenever we run a survey, there is always the question, but what about the people who don't use the library? What about the non-users? What do we understand about them? And can we find some way to reach out to the people who are currently non-users and try to find out why they don't use the library service and what we would have to do differently in order to change their behaviour? Research here in Victoria, and it's pre-COVID and when we haven't seen anything post-COVID, indicated that in any year, around 40% of the population use a public library, which is a fabulous level of reach into the community, and people use the library in lots of different ways. But it also means that 60% of the community are not library users in that year. Now, people can change and dip in and out, but we're talking that roughly 40-60 split. And trying to conduct a survey of non-users is by definition difficult because they are not predisposed to participate in a survey about public libraries. It's there in the non. It tells you straight up, these people are going to be either hard to get to or reluctant to respond. Nevertheless, As we've run surveys over many years, and the information I'm sharing today probably picks up on surveys run over the last 10 years, whilst most of the people who respond to a community survey, and whether that be around what they like about the library or how the library could be improved, we also endeavour to get to people who are not users of the library service and try to find out who doesn't use the library, why they don't use the library, and what would have to change to make them a library user. Now, please note that the titles here say more likely to be a library user and more likely to not be a library user. It's not as hard and fast as these people do and these people don't, because we know that libraries appeal to people across all of the different cohorts within the community, all ages, all backgrounds, all interests. But in general, or on average, library users are more likely to be female, young families, older and retired people, students or people who are looking for a place to study or work that's not home, people who are unemployed or don't have access to computers or the internet, and in most importantly in the last few years, particularly pre-COVID, post-COVID, people for whom working at home is not a great place to be working. So they look for somewhere else that's not at home and not at their original workplace, and the library is becoming that sort of third space for them. Then we look at the people who are less likely to be library users, the non-user groups. Working people, teenagers, cold communities, Aboriginal and Indigenous people, people who cannot get to the library because they don't have a personal means of transport, or people who are housebound or live in residential care. Also, you've got to remember, people with low levels of literacy. We always like to think that libraries are welcoming and a great place and a nice place to be. But libraries are full of words and books, and from some who have low levels of literacy, the library does not present as a great place to be. So on average, this is what our users and our non-users look like. And we understand that part of that is around inclination and what people want to do with their time and how they choose to use their time. Some of that is around wanting to access the resources that a library provides, whether that be books, physical or digital, whether that be participating in programs, using technology that an individual may not independently have access to, or just using the space. There's lots of different reasons why people use a library, and then for the same reason, there are reasons why people don't use a library. Access, inclination, lifestyle, and time of life. And often when we're talking to libraries about the users and the non-users, we run them through the life cycle. And again, this is on average, but we tend to see higher levels of use for young people, and particularly those 0 to 5 years who are active in the early or taking the opportunity to access early years literacy programs. You then see participation through the school years that drops as you go from primary to secondary. There's a bit of a drop with tertiary education and those years of independence out of school, except for those who come back and use the library as a place to study that's not at their university or home. Use then picks up again as we get the young families who have the young children and they're bringing those for early years. It drops off then during the busy working years and when the families are getting older, and usage tends to then increase again as we age through into retirement. But again, different use of different services, different demands and different expectations as people move through the life cycle. Now, let's get to the non-users. Why don't people use public libraries? If there was a single factor that differentiated users from non-users, it would be a lot easier to engage. Is it just families with preschoolers versus families with teenagers? We know that some of those are more likely, but it's not a binary yes or no. Is it the time poor versus the time rich? Is it people under 175 centimetres and those over? People with tattoos, people without tattoos? If it's a nice single factor, we could approach the non-users much more easily and identify them more easily. But library users aren't a homogenous group, so there's no reason why the non-users should be either. People use or choose not to use a library for different reasons, and those reasons are varied. Working people because they're time poor, teenagers because for some and their peers, the library is not seen as a socially desirable location. There are people who don't know what a library has to offer due to their background or past experience, and people who can't get to the library. Ultimately, there's a mix of different factors at play: personal, practical, lifestyle, cultural, and sometimes historical. Through all the work that we've done and the surveys that we've conducted, to our level of thinking, there appear to be 6 different types of library non-user. That's 60% who don't use the library are non-users, and they fit into these 6 categories: the uninterested, the independent, the circumstantial, roadblocked, intimidated, and the unaware. Now let's step through each of these. Firstly, the uninterested. I don't want to use a library. I don't care. I'm just not interested. They may have little or no experience of a library. They will say that they don't read for pleasure. They have recreational or social interests that don't involve reading or research or information related activities. They just don't want to or feel that they need to be involved with a library. And it's very difficult to engage them in conversation at the library because they are not interested by definition. The second group are the independent, and these people are more open to libraries and everything the library has to offer, but they have alternatives. They are independently capable of buying books if that's what they want to do. They will have access to their own technology, whether that be a computer, a laptop, Wi-Fi, a broadband plan, whatever it is. They have their own spaces to relax and things that they do and ways of meeting up and in using their time. They feel like they have everything under control. They don't have demand, so they just don't need a library. Nothing against the library, they just don't need it. Group 3 are the circumstantial non-users. And for this group, it's a case of not now. And some of those independent library users on the previous page can sort of flip-flop in around the circumstantial. They know what a library has to offer. And if they had more time, if they weren't so busy, then they might use the library. But right now, they're time poor. There are lots of other things pressing on them and their work, home, family circumstances. And so right now, they're just too busy. And if you go back to the life cycle diagram earlier, you often find people within that sort of 40 to 60 year age bracket come across as circumstantial non-users. The library's fine, but not right now. Next, we move on to the roadblocked. And for these people, they can't get access to the library. They'd use it if they could, they just can't get there, whether there be in person or online. It might be about library opening hours. It might be around lack of transport. It might be around disability access. There are a range of different potential factors. And whilst we might, those of us who are more fortunate in our circumstances, say, you know, if you really wanted to, you could find a way to get to the library. That's true and it's not true. For some of the roadblocked non-users, these are real and insurmountable barriers to them getting to the library or accessing library services. And more recently, of course, with cost of living pressures, the financial ability to be able to get to the library, again, has impacted and increased the number in the roadblocked category. The last two, intimidated. Someone who had a bad experience in a library. Now, can you have a bad experience in a library? Yes, it does happen from time to time, and it doesn't happen often, but some people hold on to things more than they should. They may have been shushed by a librarian a long time ago. There may have been a library fine. It may not look like the sort of place that they want to go. There are too many young people hanging around. Well, often not. It might be too noisy or too quiet inside. It doesn't fit up with a place that they would like to go, and so they choose not to go to the library. Interestingly, this group often are people who would benefit from using a library, but don't take that step because of a past and a bad experience. Finally, we have the unaware non-users, the people who don't know what a modern library has to offer. For this group, often you'll find that the last time they were in a library was at school, which if you're 22 is not that long ago, but if you're 72, that's a long, long time ago, and things have changed in the last 50 years. I mean, libraries have changed dramatically in the last 5 and 10 years. So if you haven't been into a public library for 20, 30, 40 years, you've got little idea of what's on offer and the way in which libraries work and reach out to a whole range of different people within the community. We also find that there are a significant number of migrants and refugees who may have come from countries where the concept of a free, open public library is not something that they're familiar with. And so again, they fit in the unaware category. Now, from the surveys that we've done and cobbling together little bits of data from here and there over the 10 years, here is what we think the proportion of each of those groups are. We've got our 40% of library users, give or take a little bit. But let's call it 40. That leaves 60% who are non-library users. The uninterested, the just don't cares, 18%. The independent, I have alternatives, 14%. The circumstantial, not just now, 8%. The roadblocked, I can't get there, at 8%. The intimidated, fortunately, the smallest group on the pie chart at just 3%. And the unaware and people who don't know what a library has to offer, sitting there at 9%. So if we look at those 40% users, there's 32% there in the uninterested and the independent, who you're probably not going to get to for quite different reasons. And then that leaves a remaining 28% over on the circumstantial, roadblocked, intimidated and unaware that you might be able to reach out to and engage. Now, why do these people not use the library? When you then ask the question, what would cause you, or what would have to change? The answers are bleedingly obvious. This is not rocket science. For the people who would classify as roadblocked users from one series of questions, what would have to change? They'd like longer opening hours, reduce one of the barriers. For the people who, through various questions, could be classified as unaware, what would have to change for them to be a library user? For 72%, knowing more about library services. For the intimidated, make the library a more welcoming place. It's pretty simple. If you understand the different non-user types, you can then understand what's keeping them away from the library and what you would need to do if you wanted to pursue these groups and encourage them to be library users. So, what I'd argue is, for the uninterested, just leave them alone. Yes, it would be better. Some of that group could clearly benefit and would have advantages in accessing and using the library, but the starting point means they're unlikely to engage and it's going to be very hard work. So, simplest thing to do, given that we know libraries don't have endless resources, is just leave the uninterested alone. For the independent, the I've got alternatives, there may be a time when they're not so independent. So I think there's a group where if you maintain general awareness of what the library has to offer, they may come back. And they're okay with that. They are predisposed, they'd argue that they know what a library has to offer. And if things were different, they might use the library. We also find that they tend to be strong advocates of a library service. For the circumstantial, it's about timing. Keep them aware of what's on at the library, what's happening at the library, what's available, and in time, they will probably come back. For the roadblocked, the people who can't get there, opening hours, new service models that take the library out into the community, and there, Nerida's presentation around social prescribing is a way of reaching out to some of those people who would be otherwise roadblocked from accessing the library. Again, disability access outreach. You've got to try to take down the barriers to get to this 8%. If you want to engage the intimidated, it is hard work because they're holding on to something that they've had for a while, and sometimes it could be a long while. But getting rid of library fines, and most libraries are there now, and promoting the fact that we no longer have charges for overdue items, that's one little step. The look and feel make the library inviting and welcoming. We'd like to think that libraries are that anyway, but that's not always the case. Have a look at that. Get a workforce profile that reflects the diversity of the community, and really get the people who use the library and the different people who use the library to champion what the library has to offer within their community. Finally, for the unaware, these are the people who don't know what a library has to offer. For them, you need to engage them, and the best way to engage them is through other groups within the community. Yes, you'll have your marketing campaigns and information sessions that you can run about what's on at the library, but work with other community partners, the people who, through their own reasons, connect with these non-user groups. So that might be local multicultural groups with aged care homes, different youth groups. Catch up with those who can reach out to these groups as intermediaries between you and those non-users. Yes, I put social media there, but most of the unaware are on social media because otherwise they'd be aware and they'd be appearing somewhere else in the chart. So, where are we? We know that public libraries are for everyone, but that doesn't mean that everyone will use a library at any time in their lifetime. We'd like to think they could. We believe they could. It doesn't mean they will. In the same way that library users are different, the non-users are different people too, which means you have to think about engaging them, should you choose to do that, in different ways that respond to the reasons why they are non-library users. Break down the barriers, use communication, target the different groups within the unawares, and finally accept that you're never going to get everyone. And here are two quotes from library surveys that we've conducted in the last few years. Whenever you run a survey and ask people about the things that they think are fabulous or wonderful about a library, we get lots of the first type of quote. The library is central to community life, a source of knowledge, a meeting place, a symbol of community strength, and open to all. And every now and again, when you get the non-users, and this is not all of them, by no means all of them, but sometimes you'll get a quote like the bottom one. It costs me a lot of money paying my rate for something I don't ever use or I'll never use. Make it support itself financially. So lazy teenagers can, I've actually edited that little bit. Some people just don't want a library. They don't want to support a library. That's okay. Leave them be. But if you want to grow the reach of your library, think about the non-users and how you might be able to get to them. So that's me. If you want to know more, libraries, analyze with a library in the middle. That's it.
Right. Thank you, Ian. That's a very interesting presentation. And we've had quite a few questions in there, but the fabulous Jackie has stepped in and I think answered each of them. If there's anything in there, I'll just have a quick run through. But I think Jackie's actually got them covered.
Jackie, of course, is the J in INJ.
Yeah, I gathered. Yeah, I think Jackie's got it covered. Erica was interested in your paper, which was in Public Library Quarterly. It's behind a paywall. Is there another place where I imagine your blog has got, Jackie was saying, a lot of data on it?
Yeah, pretty much everything in the article is in the blog. It's pretty easy to find them. I think there's 3 articles that talk about non-users. February 2022, there were 2 of them, and another one in February 2024. So everything you're going to find, everything I've just talked about is on the blog.
Fantastic. All right, that's great. Has anybody got any other questions? Got people saying thank you for the presentation, important insights. Thanks, Africa. All right, well, I've got a couple of questions. Do you have a feeling like those groups that you identified of non-users, do you have a feeling that there's one group in particular that are sort of like the low-hanging fruit that you might have most impact on initially?
Okay. Like all of these things, yes and no. As I said, uninterested, leave them be. The independent, again, I'll partition them. I think a good general communication message to the community, keeping that general awareness within the community of what a library has to offer is incredibly important, because it reaches out to the independents, the circumstantial, and the unaware. The intimidated are difficult. So that leaves two groups that I think are where you can best invest your effort. One is to the unaware, and that's through partnerships with other groups within the community. The second is the roadblocked, the people who can't get there because there's something in the way or something preventing them. That's where you need to think about opening hours. You need to think about outreach. You need to think about the service models that you provide in ways of getting the library out into the community to reach the people who can't get to you. Now, Nerida's work is a classic example of reaching out to roadblocked non-users. So for me, it's the roadblocked and the unaware that are the easiest to get to. And there we're talking about an 8% and a 9%. That's 17% of the community, 1 in 6 people that I think you could get to without a ridiculous amount of effort. Which, if you could get some of those people to be library users, suddenly the 40% becomes 50%.
Yep, that's all good advice. Are you aware of any libraries that have actually had some inroads to some of these non-user groups in following, interventions that they've purposefully undertaken?
It's an interesting one because libraries tend to be so busy working with the users and concentrating on the users. There's not a lot of energy and effort left to get to the non-users. And so from our experience, what we'd see is fairly small scale efforts to reach out to the non-users. But the two things, again, it comes back to your earlier question, working with community partners and looking at things like opening hours or accessibility, that's where libraries have had some success, particularly the partnership one. If you can get community partners to either through outreach or bringing groups into the community, once people see what a library has to offer, the level of use and engagement can increase pretty quickly. You've just got to get them over the threshold.
Right, thank you. And Joe, you've got your hand up.
Yes. Sorry, I'm just trying to lower my hand. Yeah, not necessarily a question, but it's very interesting to see that that, at a period in teens that they may not necessarily come to the library. But I guess what I would actually say to that is that there are also some libraries which have a huge number of teens that attend. And so it would be interesting to work out what is it in one library where there's a lot of teens and compare that to another library. And I guess just an example is a library that I used to work at, like literally Friday afternoon, we could have 70 teens.
Yep.
And so, yeah, so, and there are reasons which I sort of figure around that, but I think it would be a space where there could be more research done in to kind of say, well, what is it where you can get, huge, big groups and other groups like that. We used to do a Friday sausage sizzle.
Yep.
Food is always a good one, but.
That's a good point, Joe. And from our experience, so This is just off the top of my head, so nobody go putting any validity to any of this. One, sometimes it is around food and activities. Sometimes it's around the lack of alternative spaces or making the library the most attractive community option. And we've just finished working with a library where 3 o'clock in the afternoon, this place goes from 4 people to 34 people. You also find where the library provides group study spaces where kids can sit around a table together. They can make a little noise, but feel like they own the space.
Yeah.
For that sort of 3 o'clock to 5 o'clock, 3:30 to 5:30 time.
Yeah.
And on top of all of that, the approach of the library staff to make them feel welcome and engaged and part of the library community. Yeah. So there's a couple of things.
Yeah. And I think, look, all of those I would completely concur with just from my experience as a public librarian. But yeah, I think that there would be, it's just, sorry, I feel like I'm suddenly monopolizing a conversation here, but I hear, you know, so many comments, oh, we never get teens to our library or da-da-da. Well, you know, so yeah, I think there'll be a lot of people who would be interested if you did some research in that space, Ian.
Okay, I'm just looking through any more questions there. Sumaya, I don't quite understand your question there. Sumaya say, why do we have social prescriptions only at City of PAE, Town of Walkerville and City of Prospect? Not sure how to answer that one. So if you've got anything to clarify on that, just pop it in the chat as well. Other people are talking about things that their libraries do to lure people with food. Excellent. Staff interactions with young people are so important. Thank you so much, everybody, for your comments. And thank you to Ian for your presentation and to Jackie sitting somewhere with very busy fingers getting all those answers through for us. I really appreciate your input as well.
Everyone needs a Jackie.
Everyone needs a Jackie. Totally agree. Okay, well, that brings us to the end of this particular session. There's another session this afternoon from 2 to 3:30 where we have another 3 speakers who will be talking to us about Indigenous perspectives on public library services. So again, a very big thank you to our 3 speakers, Joe, Nerida and Ian. It's been fantastic to hear from you. Thank you to everybody who has come along today. These sessions are recorded and you'll be sent a link to the recordings. Everybody who's registered will get that. So you'll be able to share this with your colleagues and catch up on things you can't get to yourself personally. So thank you everybody for attending. I hope we see some of you back at 2 o'clock and it's been lovely to spend the morning with you all. Thanks so much. Bye-bye.